We will tell you what you can sell. When you give a government department the power to regulate, you think it's not going to regulate? And that's what they're doing. They are regulating and they're doing a very bad job at it. But that doesn't mean that change can't come. There are, like at the WHO, there are really smart people working at the FDA. There are people who understand that as part of a tobacco harm reduction package, vaping and pouches should be on the table, should be actually rather on shelves so that people can buy them. But the slow roll of approval is alarming, as I've written about quite recently. I'm okay with them enforcing the law and trying to remove some of these products from the shelves. It's good that an agency enforces the law, but they're not also enforcing the law on themselves. They should be reviewing these proposals within 180 days, and they're not. So I'm in favor of enforcing the law, but they should be sanctioning themselves, and they should be approving a lot more products. Because if you did that, people will have the choice. Give the consumer the choice, and they will buy the products that are most beneficial to them. And that includes some people are going to continue to smoke Marlboro Reds, but a lot more people will switch to products that are more benign to their health. And so the FDA has failed overall, but that doesn't mean it always will. I feel as though, and here you do have a feedback loop, unlike the WHO, and I think this is important to realize. The FDA is to a certain extent responsive to the administration, to the Trump administration, and also in terms of the budgets to Congress. This is not how the WHO operates. It's like it doesn't have that level of oversight. I've always actually been really impressed as a Brit. I've always been really impressed in America at the ability of senators and congressmen to actually extract information from the administration, from agencies. What are you doing? If you're failing, how are you failing? And so it's very easy to be down on the United States government, but those feedback loops, that oversight is incredibly important, and we literally have none of that when it comes to the WHO. So I have far greater faith that we'll have change and beneficial change at the FDA than I am at the WHO.
Dr. Bate, you're among the experts taking part in the TPA's Good Cop 2.0, the counter conference to COP 11. What message are you hoping to deliver there?
Well, I'll be talking about the research paper that I've done, talking about how there is how people are learning from the bad actions of the FCT Secretariat. But I also think that's an opportunity for all of the tobacco harm reduction experts out there. There are people who are out there in the trenches trying to say, but hang on a minute, why are we spending all this money on pandemic prevention when everybody's still dying of cardiovascular disease, malaria, tuberculosis? How can they ignore rational scientific opinion? Well, I would argue that tobacco harm reduction advocates have had the last 10, 15 years of understanding how the WHO can operate. They should be going out there and explaining to the rest of the world how dangerous a global health body which ignores science can be. Because I would argue that the rest of the world is where maybe the tobacco harm folks were 10 years ago. As if only they just read the science, it'll be okay. They'll just realize that vaping, yes, it's not always 100% safe for people who may have lung issues, but overall, it's a good cognitive dissonance, funding pressures, the ability to exclude dissenting voices means that they don't have to listen. And that's the direction the rest of health is going.